Whenever we receive a call, our question is, this is the Austin Police Department, do you need police, fire, EMS, and now we say, or mental health services. We would have to stay on the line with our callers who were suicidal until officers got there. Now one thing that we're able to do is, while yes, we are taking information from our callers regarding police safety and their safety as well, we can actually transfer to our C3 team who is able to stay on the line with these callers until officers get there.
Within Austin, Texas, there was an audit that showed that we could definitely do better when it comes to responding to people with mental health, so it's safer for everyone involved. But particularly the one that impacts us, why we're here, is there was a recognition that when people are in crisis, they often call 911, in mental health crisis specifically, because they don't know who else to call. And so the idea is that we have counselors that triage and screen, do safety planning, and then determine the outcome so that we can provide the right care at the right time.
It's important because mental health can be a lifelong condition, and a lot of folks, they don't know how to connect to support, they don't have the support that they need, and in order to reduce the frequency of 911 calls, and also in order to transition from a crisis basis into ongoing services, we would have that goal of assisting that person also so that they can be stable, that they can have a healthier life, so that they can thrive instead of continuing to experience frequent crises.
You know, I knew that I wanted to help people, and I looked at sort of how people were being responded to and sort of the resources spent on people who are having, mental health concerns, and what are some ways that we can spend those resources to help them, access longer term care. And so a lot of times people who are experiencing psychosis or something like that, or are sort of out of options, feel that they call 911. And so we're there to be that person to say, you still do have options, and these are those resources we want to connect you with for longer term care. And it honestly feels really good to be able to serve the community in that way and help get someone from, their worst day calling 911 to enrolled in services and getting the help they need long term.